Welcome back, everyone, to the Mental Health Evolution podcast, where we are talking about how the hmm, landscape is quickly evolving in the mental health industry. Today, we are joined by Shirali Nigam and Arul Nigam, sibling co-founders of Circuit Breaker Labs. Shirali is a researcher and entrepreneur working at the intersection of AI safety, psychology, and technology. She holds an MBA from the Wharton School at the University of Pennsylvania with a focus on entrepreneurship and innovation. Arl brings expertise in AI applications for healthcare and studied operations, analytics, and global business at Georgetown University's McDonough School of Business. Together, they founded Circuit Breaker Labs in 2025, very new company with a simple but critical mission to be the first line of testing for AI mental health tools before those tools ever interact with a real person. The way they do this is by sending simulated patients, essentially AI powered test users, into conversations with these chatbots to see how the technology responds when someone expresses distress, mentions self harm, or is in crisis. It is the same idea as a crash test for a car. You do not wait to find out if it is safe by putting real people in danger. You test it first under the hardest conditions you can create so you can know exactly where it fails. For mental health technology, the first line safety check does not yet exist as a standard practice, and that is the gap that Shirali and Arl are working to close. So thank you two so much for being here.
Thank you so much for the kind introduction and for having us on. We're so honored and excited to be here.
Awesome. Well, as usual, we talk about a few articles for our listeners to kind of give some background to the conversation today. If you are new to this topic, we talk about technology a lot on the podcast here in mental health, but I want to review some of the content that's out there. So the first one is called AI Chatbots Systematically Violate Mental Health Ethics Standards. And this article is 2025 Brown University, and they did a study looking at AI chatbots routinely violating established mental health ethical standards. Researchers used licensed psychologists to review simulated chats and identified serious failures, including over validating user beliefs. That's something I see a lot just in my own interaction with AI. Responding indifferently to crisis situations and suicidal ideation, and failing to refer users to appropriate resources. The study highlights a critical gap. Unlike human therapists, AI systems have no governing boards or accountability mechanisms when they cause harm. That article is in the show notes if anybody is interested in reading more on the details of that. The second article that we have is called Experts Caution Against Using AI Chatbots for Emotional Support. And this is from Teachers College, Columbia University, also a 2025 article. And faculty researchers from Columbia's Teacher College warn that the design of generative AI models makes them poor substitutes for mental health professionals. The piece documents real world harms, including people with no prior mental illness developing delusions after chatbot interactions, and multiple teenagers dying by suicide after prolonged engagement with AI companions. Those are some sad cases we have all kind of known about in the news. Experts note that AI systems are coded to be affirming and agreeable, which can be deeply dangerous for users in acute distress or with difficulty distinguishing reality. And then lastly, our third article I want to mention here is Agentic Red Teaming for Mental Health Safety. And this is a paper written by Circuit Breaker Labs, our guests here, their white paper. And this brings us to what we're going to talk about today. They published a white paper introducing a novel patent pending approach to clinically realistic pressure testing of conversational AI. Their framework, which they describe as agentic red teaming, goes beyond standard safety checks to simulate the kind of complex, emotionally charged interactions that real users in mental health distress might have with AI systems, drawing on what they call the intersection of the Hippocratic Oath and Asimov's first law. Shirali and Arul are building the infrastructure for a safer AI powered mental health landscape. And that is exactly where we're going to launch our conversation today. So, without further ado, let's go ahead and talk about your paper a little bit. Even the terminology, agentic red teaming for mental health safety, might be something that a lot of people aren't familiar with in terms of terminology. Can you kind of describe a little bit about what that means?
Yeah, absolutely. So I think the concept of red teaming is something that comes from like the cybersecurity domain. When people are building these software solutions, they want to make sure hackers can't get into their systems. They know
Mm,
where vulnerabilities around data security and data protection are. And so they basically do these large scale tests when they're building their tool or as they're pushing new changes to their products to find, where are the vulnerabilities going to emerge? What are the weaknesses in my product today? So we're trying to bring that kind of philosophy of large scale testing, looking for vulnerabilities to the AI space. So what we've designed is a system, as you mentioned, on how we can realistically simulate patient interactions, find those cases where AI isn't handling crisis escalation appropriately while people are developing these AI interfaces. So they know exactly where their tools are falling short, where they need to add more guardrails, where their system should recognize that we need to escalate this conversation to a real human being.
mm,
And because generative AI, large language models, they are probabilistic systems. So what that means is when you're talking to ChatGPT or Claude, the way it generates a response is by looking over like a large set of text data and trying to predict what is the next probable word. So for example, the
mm,
sentence, the doctor wrote my based on like what we know about language, you might guess prescription, and that's like very
mhm,
similar to how large language models work. So in order to actually find where the vulnerabilities are, you need to test a huge range of possible scenarios to see when are the times it doesn't guess prescription and it guesses something else that could be a harmful output. So our framework is designed to simulate a large scale of test cases so we can find where those vulnerabilities emerge.
And as for the agentic portion, that
mhm,
refers to the system kind of having a stated goal, but then adapting dynamically and sort of making decisions on the fly. So rather than having like a perfectly scripted set of test cases and back and forth, the model, the agentic part of the model, knows how understands the context and knows how the model should respond. So it'll, query the model once and then based on what response it gets in return, it'll decide how should I adjust my next message? What should I say? What context should I draw upon? So it's behaving a lot more like a real person rather than just a, you know, manually pre-scripted set of interactions.
mm. And how did all of this come about? How did you all decide to come up with this idea, to start this company, write the white paper? I'm very curious to kind of know that side of things.
Yeah, absolutely. I think for Arul, like, and I, the mental health space is something that's like very personal and meaningful. We've unfortunately lost friends to suicide before AI was part of the equation. And so when we
Mm,
saw these cases emerging with Adam Rain, Sul Setzer, we saw AI as a tool that could be such an important layer of support, connecting people to providers or helping them find resources that they might not otherwise have access to. But in order for these tools to really get out there, spread, and help people, they needed to be safe. And we had this kind of unique overlapping of capabilities to do something
mm,
about this to help AI scale responsibly and actually be a resource for good in the mental health domain and not let these tragedies continue. So decided to kind of join forces and work together. You mentioned my background in biomedical engineering and more of like the neuroscience side. Arl has spent a lot of time doing ethical AI research, especially in the domains of like mortgage lending and when you think about data proxies, not specifically asking for like protected attributes, but those emerging from other pieces of information and how you really mitigate those kinds of things in AI. So together with our like AI and clinical expertises, we knew enough to kind of get the ground rolling and then engaging clinicians and experts to really help us build this so that as people are building tools that are meant to help, we can ensure that they don't do any harm along the way.
Yeah. I mean, I think it's an amazing idea because as we have talked about this on the pod and as I've researched, it's just such a tricky thing. There are so many elements that AI touches the industry all the way from how we do billing to client care, right? Potentially there's this spectrum. And those protections and those safety pieces are so critical. But then you're even talking about people that just use it for mental health support on their own, right? They just start talking to ChatGPT and it becomes kind of like a relationship or an advice giver or things like that. Having some kind of protections in place feels like a really big deal to me. Um, I'm curious what you're finding as you're doing some of this testing so far.
Yeah, absolutely. I think it's been really interesting to see how the like foundational models have evolved in terms of their,
Mm.
like how they're considering safety and how they're implementing those practices. So we're really working with anybody developing an AI interface. So that goes beyond foundational models. It's people who are building emotional support companions, your AI best friend, your in between provider session, kind of mental health chatbot
Yeah.
to reach out to. And so everyone has like a very different approach on how they're handling AI safety, but from evaluating some of like the foundational models and seeing where the vulnerabilities emerge, I think it's been really interesting that the vulnerabilities emerge in a lot of nuance. So one of the examples
Mhm.
we talk about is acetaminophen, like the word for Tylenol. If you misspell that, it often gets past the guardrails. And there's been literature about how that is a better predictor of imminent suicidal ideation than the word suicide itself. So just a typo
Mm,
being the reason that safety flags don't go up is quite alarming. And I think that's due to the fact that when you're doing safety testing, there are so many different layers that need to be evaluated. Of course, you want to look at multiple diagnoses, different risk levels, cultural context, different like language patterns. And so to really evaluate this entire like risk surface area, we need like an approach that's scalable. And so I think
mm,
like that is like one example. And, like on top of that, when people talk in more nuance in the case with Zane Chamblin, he referred to going on like a long drive. And that was something that ChatGPT had missed in his messages. And so when we try to incorporate more of those statements, I think a lot of the models and AI systems that are built for general capabilities, like that could be something else that a user is talking about as well, not necessarily suicidal ideation. So trying to see how you really like balance detecting that nuance and finding those vulnerabilities. And, in some ways, when we know those things have been linked to real tragedies in the past, we feel that like it makes sense to be a little bit more overcautious in that domain, even if it could be referring to something else, especially when we've seen real tragedy come from that.
I think also
mm,
to that point, one of the interesting and concerning trends that we've seen is as, over time, as models get better, hopefully the safeguards and guardrails will improve, but at the same time, the capability of the models improve and increase as well. So the downside risk and downside potential of if someone's able to, skirt the guardrails just becomes more and more pronounced over time in terms of what kind
mm,
of dangerous information the model could give out, what it's capable of role playing, or what it could,
mm.
encourage users to do that might be harmful to themselves or to others. So we actually see it unfortunately as a growing problem, even though we're hopeful that the safeguards will improve over time.
Interesting. So what who are your clients? Who reaches out to you and says, "Hey, we want to test our AI system." What does that look like?
Right. So we're working with people building in the application layer. So someone building some sort of app on top of one of the foundational models, like GPT or Claude, whatever it may be. But then on top of that, they have their own infrastructure, their own knowledge bases,
Mm,
and it's really targeted to a specific use case. So, of course, like the most natural fit that we work a lot with is people building, like emotional support, emotional regulation oriented chatbots. So there aren't a lot of like outright therapy chatbots, and I don't think the technology is there yet. But like Shirley mentioned, a lot of developers are building tools to support people in between sessions, late at night, when they don't have access to a provider, for example. So that's one bucket, but we've actually seen interest from um, really anyone building conversational AI that interacts with people, because
mm,
really any interface like that is at risk. A lot of like the tragedies that have been covered and that we've seen, like with Gemini, ChatGPT, Character AI, Replica, these tools were never meant for therapy. The developers never built them that way or said like,
yeah.
this is a therapy chatbot. It's just that it's a conversational interface. People felt comfortable. Um, Interestingly, like people actually sometimes feel more open talking to AI versus humans because they think that AI can't judge them and there's less stigma. Even though, that's not necessarily the case with humans, but
Hmm.
that's just what people think.
Yeah.
So really developers of any chatbot that's interacting with humans are concerned about this problem and they're acting out of the goodness of their heart. They've tried whatever
Mm.
solutions they can, but just haven't found anything before that was built with mental health in mind. So really any human-facing AI, um, it like could work with us. And we've been really fortunate to have a lot of great partners across the ecosystem.
I love that you're doing this. And I have just from being a therapist myself for 27 years, right? I am like, there is no way to predict, like for me, with a lot of experience. I know I don't have the same maybe ability to process in the way that AI does. Um, but I have, you mentioned like the nuances or where you're finding these things. And I was like, yes, that resonates with me because I don't know how you can really test or predict some of the ways that people might indicate safety concerns. Like when I'm sitting with someone, the way that that comes up is different for every person, right?
Yeah, absolutely. And I think that's where like so much of this challenge emerges because for a lot of other domains, you have like de-identified cardiology data that you can look at and try and find patterns and teach like the AI, like this is exactly what you do. But I think in the realm of mental health, each case is so different. And so it's not like, oh, if the user says this, like this is exactly what you do. It depends on so much context, so much about like the
Mm-hmm.
user, especially. I think like people think like, oh, I've tested like this diagnosis, I'm set. But like even in the real world, people who have
Mm-hmm.
the same diagnosis present so differently. And a lot of it also speaks to like the goal of their interaction with the chatbot. Some people don't have access to care, so they're trying to use their chatbot in that respect. Some people are just trying to use it to kind of practice like what their providers have told them to do in between sessions. Some people are very reluctant to seek out help. And so the AI is kind of like their first line that could connect them to
Mm-hmm.
real resources. And so all of those factors have influenced how people are having these interactions. And so I think that's like, in terms of like the approach we're taking, I think we're really thinking about how can we try and simulate every possible interaction because the like we don't have like, oh, if we've simulated these 10 we're covered. It needs to be like we've simulated this million and like hopefully we've covered a lot of them, but even still like the only way you can get more and more confident in a system is seeing them test more and more possibilities because it's just like such a challenging problem to really know that it how a user might say something is going to be registered correctly by the AI.
Mm-hmm. Mm-hmm. Do you see this as something that might be, I'm almost picturing like with food and certain products, like people go through the like to be certified organic, right? Or something like that. Do you almost see that this might be the future of AI systems that they might go through testing and then be like, this has the stamp of approval for AI testing here of safety. And probably, I'm guessing it has to be more like percentage, like it's 90% safe because you can probably never say 100 based on what we were just talking about.
Yeah, absolutely. I think it's definitely like like this percentage likely that this chatbot is safe, especially while we're using these like generative AI kind of capabilities. But I think your food analogy is like spot on. We would love to see that as a standard because I think like for people building in like the AI space, it's always this like move fast and break things kind of mentality, which like when you're
Mm,
in the startup world, like you need to move fast, you have to like win quickly, but this is such a high risk thing that you could risk like breaking. So I think we need to modify that thought process a little bit in terms of like how can we innovate quickly but in a safe way. And so that was part of the reason that kind of inspired this approach is that like people who are, just starting to build their companies, they want to do some good in the world by creating this like AI enabled in between provider session support companion interface, for example. We should give them a way that they like if they care about safety, like they should be able to scale and test quickly and not kind of, be slowed down or like hurt because of their commitment here. And so I think that's like part of the reason we kind of landed on this approach in terms of how can we make safety testing like part of fit into a developer's workflow as quickly as they can so that they can before
mm.
the market like gets on before the product gets to the market they can run these like tests and really have confidence that what they're building works effectively.
And I think also to your food safety analogy, we're not trying to be like prescriptive or control or limit people's options. We're just trying to help the
Mhm.
general consumer end user patients make informed, educated decisions. And so that's why we're running these tests. We're providing validation or a confidence level, and really highlighting like where are the strengths and weaknesses, so that a parent or a patient, whoever it may be,
Yeah.
when they're selecting, or even a clinician for that matter, like when they're selecting what chatbot can I use or what can I recommend to my patients, to, bridge like the access to care gap, they can make a smart decision and know what they're actually recommending, because we all know like AI systems are
Mhm.
generally kind of considered to be black boxes. It's hard to know what's going on, in its mind, but the more evidence and the more information that we can put out there, the easier it is to make those like responsible decisions.
Yeah. Shirali, when you were talking, you said if they care about safety. And I thought that was really interesting phrasing. And that leads me to my question. If a parent or a clinician or someone is looking at things, what should people be aware of? What should people be looking for or looking to be wary of?
Yeah, I think for us, it's kind of like two key points that I think when we're looking at AI systems, we want to, I mean, even before we've done our testing, like what we're thinking about in terms of is the system safe? I think one is a lot of companies can make promises about, we've done our best to make it safe, but we really look for proof that they have tried to
Mm,
implement those promises. And so, I mean, from our perspective, like we've built things before until somebody else comes in and uses it. Like it's hard to know where the vulnerabilities and issues are. So I think having that like independent safety
mm,
evaluation is really important, especially like to show that, like we've done our best, but other people have also looked at it and can say that it's safe is really important. And then I think also in terms of like the breadth of testing, there's like a lot of fortunately, we've seen like a lot of work in this space on how can we like make tools safer? What should we be testing AI systems with? But to like the point of what we were discussing earlier, running 10 cases isn't going to be enough to really assess how an AI will behave. And so I think seeing what they've done to put their safety promises into practice, but also like to the extent that they've done that. Is it like we've added a handful of guardrails, we've run like a few dozen tests, or are they actually like trying to break the system and they haven't been able to break it? Because I think that really shows that, okay, this is like a robust system that's going to handle most interactions safely. And so it really goes to that, like when you're looking at an AI system, what do they mean when they say we're building safely? And to what extent is that safety like a priority for them?
Cool. I love that independent testing and looking for that evaluation. That seems very smart. Um, One last question here about, and this is about policy. There's a lot happening. I know Illinois has passed a law. The state of Maryland is looking at passing a law restricting some of the AI as a therapist kind of model. I'm curious what some of your thoughts are about that. How can policy best support or regulate this process? What would be useful in your mind?
Yeah, absolutely. And being close to DC, we've been fortunate to engage a lot with, members of Congress, their staff, federal agencies. And I think there's kind of two schools of thought. One is like enforcement after the fact, and then one is before the fact. A lot of the time you'll see for after the fact, like if there's a violation or a risky information, like a risky model response, then there's some fine that the company has to pay, but that's too little too late. By that point, the harms have
Mhm.
already occurred. It's also difficult to to actually enforce, I think.
For
Um,
sure.
so what we like to advocate for is kind of validation before the fact, so before any of these risks can even make it into the hands of the end users, so that we're sure, like just like with food safety or with like
Mm,
automobile safety, we know before the car is on the road or before the food is in the store, it's safe. Like it's probably not gonna harm the end user. That's kind of what we tried to advocate for. So like Shirley was saying, like independent validation, third party auditing, pressure testing. I think also like with the examples that kind of revolve more around like marketing and language, there's a lot of limitations with that as well. Like we saw Illinois said chatbots can't represent themselves as AI therapists, and then
mhm.
the next week everyone just rebranded to AI for emotional support instead of AI for
I
therapy, and
know.
then
It's like
nothing changed.
semantics, right?
Exactly.
Semantics. Yeah.
Exactly, exactly.
Uh,
And so I think the focus needs to be on more concrete validation, proving safety rather than just the way,
Mm,
a model conveys itself or represents itself. And at the same time, like I think s- there's a school of thought that AI shouldn't be used for this use case at all. Leaving aside the feasibility, given that it is already the biggest use case, I think, we're optimistic about AI and there's a lot of potential. We all know there's an absurd access to care crisis in this country. I think like the patient need versus provider ratio is like 320 to 1 or something like that, and probably expanding. It's several weeks for like average wait to access care. So I don't think, AI is at the point yet where it's as good as a therapist, but for that intercession support or like lower level support, we should definitely be advocating for AI as much as possible. And, when there's real crisis, maybe using that AI to guide people to real humans, connect them to live clinicians, or knowing when the system should say like, "Hey, I can't continue the conversation. Please access these resources." Like we can debate about what the safeguards should look like and what infrastructure should be built around it, but I don't think we should be trying to regulate AI for emotional support into oblivion. I think that's irresponsible and would end up hurting a lot more patients than it would actually help. So I think a
mm.
balanced approach that allows innovation, but sort of balances that with consumer protection, just like with cars or food or countless other industries.
Okay. All right. So for final send off, what's next for Circuit Breaker Labs?
Yeah, we're really excited to keep building in this space to make more and more apps like safe from the start, helping them ingrain this, clinician expert insight into their tool. So yeah, really excited to work with more companies who are so committed to the safety of their product and really by doing so committed to like the safety of their end users. So yeah, very excited about that. Really look forward to also engaging with more clinicians, experts in this domain to understand how crisis conversations emerge. I think really the core of our tool is built with clinicians involved so that we know we're testing realistic scenarios. And so excited to
Mm,
kind of expand the community that we work with as well.
awesome. Well, thank you both, Shirali and Arl, for being our guests today. And I am excited to see what happens with Circuit Breaker Labs. To all of our listeners, the articles we discussed will be in the show notes for this episode, including the Circuit Breaker Lab white paper. So I hope you'll check that out. And we will be back next week to discuss more issues relevant to the mental health care community. Thank you for listening, and bye for now.